We know that there are really high rates of depression and anxiety after pretty much any medical illness. Rates of depression after a heart attack can be as high as 20–30%. After strokes, pretty much any medical illness is associated with higher rates of depression and anxiety. And then when you think about the inpatient medical setting in particular, there are patients who are very vulnerable to becoming very delirious in the hospital. And this can have long-lasting effects on people. It used to be thought that people would get confused, get delirious, and then get better, but we're starting to realize that people can have long-lasting effects from cognitive impairment from being in the hospital, but also just from depression and anxiety as well. You can have some pretty significant complications. So for years, psychiatric services were kept completely separate. The clinics were separate, the hospitals were separate, the providers there was really no integration at all. But in recent years, there's been a really big push nationally to integrate services and to really meet patients where they are. And I think this is going to go a long way in terms of destigmatizing mental health, in terms of improving compliance and getting people treated sooner, which I think is ultimately everyone's goal. Early interventions we know work well. It helps to reduce rates of delirium, for example, in a medical setting. We know that targeting depression and anxiety as soon as it starts can help in terms of reducing the symptoms. So, what better time to get to people than immediately after a stroke or immediately after a heart attack? The Psychiatric Consult Service can offer a wide range of support to physicians and other providers in the medical setting. We do consults on everything that you can imagine, from management of delirium to intoxication and withdrawal states to offering just social support and supportive care for patients who've been in the hospital for an extended period of time. We work with families, we talk to outside providers, so we can really help to not only integrate but also coordinate care across settings. And I think the nuances of practicing in an inpatient medical setting is pretty unique, and our service can actually help to bridge some of the gaps between psychiatry and medicine.